You might be wondering, what is the bottom line for you when it comes to the J&J vaccine? I got on a Zoom call with the head of the physician assistant program at FGCU today to get you some more information, and he started with some perspective in terms of how rare this is, pointing out this vaccine has been given to 6.8 million Americans.
And there have been 6 reported cases of what's happening as a blood clot that develops in the brain.
For those who've already received the vaccine and might be wondering, is a blood clot forming right now, what would you tell them?
So what they've shown is the blood clot, all 6 cases were women between the ages of 18 and 48, and they occurred between 16 and 13 days after their initial vaccine, so almost up to 2 weeks. So that's kind of the piece that we're looking at. Doesn't mean that men can't get it, it's that all 6 cases have involved women.
Are there any symptoms that people should be checking to see if they're noticing after they've received this vaccine?
So the symptoms to look out for would be a severe headache, shortness of breath, severe abdominal pain, significant leg pain, anything that seems out of the ordinary. If you feel you have those symptoms, you're recommended to seek an emergency department or call your healthcare provider.
How would this affect the goal to try to get as many people vaccinated as possible who want to be?
So certainly the Johnson & Johnson vaccine was very appealing because people could only get 1 shot. So we're now taking, in essence, a third of the potential vaccines out of circulation. So it certainly may limit the number of people that are going to be getting the vaccine.
What does that mean for them to pause it? What is the implication?
So those that have been distributed, they're still going to be distributed to the locations, but they're not going to be actually injected into the patient. So they're not going to be administering it. They're going to continue with both the Pfizer and the Moderna, but not the Johnson & Johnson, while they're going to be doing more work to determine, are these potential blood clots part of or a side effect from the vaccine administration? So that's the head of the physician assistant program at FGCU. We are inviting you to join the community conversation about this as well. We want to give you a look at some of what you've been posting on our Facebook page about this so far. Bob says, quote, "All these vaccines are experimental for a reason. Why are you people in such a hurry to get an experimental vaccine? Am I missing something?" And John Smith says, "A pause. That's awesome. Make sure you keep your mask on." You can join the conversation right now when you find Fox 4 Now on Facebook.